MS symptoms vary widely because the central nervous system controls everything. Vision problems, like blurred or double vision, are often early signs, especially if the optic nerve is affected. Fatigue is another hallmark, not just tiredness, but a deep exhaustion that rest doesn't fix. Muscle weakness, numbness, tingling, and problems with balance or coordination are common. Some experience muscle stiffness or spasms, dizziness, or vertigo. Cognitive changes like memory issues or cog fog and mood shifts, including depression or anxiety, can also occur. Symptoms can come and go with periods of relapse and remission. MS looks different for everyone. No two cases are exactly alike. The unpredictability is part of what makes MS so challenging. Unraveling the mystery behind multiple sclerosis, or MS, is much like piecing together a complex jigsaw puzzle. The cause of MS is a puzzle with many pieces: genetics, environmental factors, and the potential involvement of viruses, all interacting in ways we're still working to fully understand. Genetics play a role, suggesting a predisposition, but there's no single MS gene that definitively causes the condition. It's more nuanced than that. Having a close relative with MS raises your risk, indicating a hereditary component, but only slightly. It's not a guarantee, and many people with MS have no family history of the disease. Scientists have identified over 200 genes, mostly related to immune function, that seem to be associated with MS. However, each of these genes contribute only tiny amounts to the overall risk, highlighting the complexity of the genetic influence. It's a combination of many small factors, rather than one major determinant. Environmental factors matter too, playing a significant role in who develops MS and where. One of the most striking patterns is that MS is more common farther from the equator, a geographical trend that has puzzled researchers for years. This is possibly due to less sunlight exposure in these regions, leading to lower levels of vitamin D, which is known to play a role in immune regulation. Smoking is another environmental factor that increases the risk of developing MS and can worsen the disease's progression in those already diagnosed. The viral connection is strongest with Epstein-Barr virus, EBV, a very common virus that infects most people at some point in their lives. A major study provided compelling evidence, finding that MS risk jumps dramatically after EBV infection, suggesting a strong link between the two. One prominent theory attempts to explain this connection. It suggests that the immune system, after fighting EBV, becomes confused and mistakes myelin, the protective sheath around nerve fibers, for the virus and attacks it. This is a process called molecular mimicry, where the immune system essentially confuses the structures of the virus and the body's own tissues. However, it's crucial to remember that EBV alone doesn't cause MS. Most people are infected with EBV, but only a small fraction develop MS. It's just one trigger, albeit a significant one, in a complex chain of events that can lead to the disease. Ultimately, Mississippi develops only when several risk factors combine, creating a perfect storm of genetic predisposition, environmental influences, and immune system responses.